Okay, hi everyone. Good morning, good afternoon. Thanks so much for joining us. My name is Heather White. I'm the executive director of Together for Health, and I am pleased to present our next installment of Together's webinar series. Today's installment is titled Raising Awareness and Driving Demand for Cervical Health in Kenya. And I'm pleased to present two of our partners who will be presenting on our Kizazi Chetu campaign. In today's webinar, we will share achievements, insights, and learning from this communications campaign that Together and our partners at Scope Impact developed this year. Kizazi Chetu, as I'm sure you all know, means our generation in Kiswahili. We'll also share our plans for the next iteration of the campaign, including working with partners at Kilele Health and the Matibabu Foundation, and share how you may be involved in the coming iterations of our campaign. Following the presentations, we'll open up the discussion for questions and comments, so please feel free to put comments in the chat box as we go forward. I'll moderate that session. And just a few sort of housekeeping notes before we begin. All of the attendees are on mute. We will do 15 minutes of Q&A at the end. And if you have comments or questions for the presenters, please do put your comments in the comment box as I noted. And if we can't get to all of the questions, we'll try to follow up after the webinar. Today's webinar is being recorded and will be available on our website after the event. If you'd like to see the catalog of other webinars, please do check out that page on our website. We've got a great library of past presentations. And we'd love your feedback on today's topic or any other suggestions for future topics for this webinar series, which is very much focused on learning and information sharing around HPV and cervical cancer prevention in low middle income countries. At the end of the presentation, we'll post links on how you can get on Together's mailing list and be in touch with us directly. So with that, let me begin. I'd like to introduce our first speaker. Our first speaker is Mr. Andy Awiti. Andy is a creative strategist with Scope Impact, a social impact company focused on accelerating social change. Andy is part of an interdisciplinary team that works on identification of insights on communities of interest, concept development to broaden the diversity of voices around issues, and most recently, exploring and framing public and policy discourse on contraception and cervical health. The title of Andy's presentation today is Building a Cervical Health Movement in Kenya. And with that, I'll get started and turn it over to you, Andy. Thank you.
Hello, everyone. Thank you, Heather. Happy to be here today to share on Kizazi Chetu, from the thinking behind it, the co-creation through to the outcomes, learnings, and the vision going forward. Next slide, please. So as I have intimated, a lot of this project was developed through a discovery sprint that included data analysis and multiple conversations with a broad range of subject matter experts, thought leaders, activists, as well as cervical cancer survivors, so that we could paint a picture of cervical health in the context of Kenya. So this gave us an understanding of the social, cultural, and service dynamics that shape or influence attitudes and behaviors of at-risk women. So let's take a look at some of what we found out. Next slide, please. By the numbers, cervical cancer ranks as the second most frequent cancer among women in Kenya, and the most frequent cancer among women between 50 and 44 years of age. So despite cervical cancer being preventable, at least 3,800 women die from the disease every year in Kenya, and a very small percentage of at-risk women have actually been screened, which is about, actually it's only 16%. Next slide, please. So when it comes to perceptions, cervical cancer is shrouded in fear, stigma, myths, and misconceptions, including a widely shared narrative that it is a rich older woman's disease. And this, in many ways, makes many dissociate from the subject. Next slide, please. So access to services is also a challenge for many women, especially outside urban areas. And this is due to lack of resources, either for transport or to pay for the services, as well as concerns around the invasive nature of the procedures and lack of privacy at the various facilities that they may be able to access. Next slide, please. There's also the matter of disparities in service quality and availability across facilities. And this is even in places where they exist. And as a result, utilization is hampered through that, as well as the issue of low awareness contributing to it. Next slide. Now, there was and still is a need for broader engagement on cervical health from what we've learned in the exploration process. Some of the sentiments that came out strongly from A.B. Weime, for example, and Florence, who are both advocates around either sexual and reproductive health or cervical health, include that women need to be educated and informed about cervical health. And there's also a strong need for them to be made more comfortable with the idea of screening and associated services. Next slide. So the discussions with the various stakeholder groups shed some light on the key things that could guide our campaign. First, next slide, please. First, there was evidence for the need for a shift in how we talk about cervical cancer. So this is a shift in the language to cervical health, for example. And this will go a long way in reducing fear, which is a key barrier to any progress around cervical health. Next slide. So second, conversations on cervical health also needed to shift from what is currently a monologue to a dialogue that conversed with women and the wider society, so that we are able to tackle the stigma that impedes women from taking charge of their health. Next slide. There was also a need to make there was also the need to take a more inclusive approach to cervical cancer elimination. And this is across genders, across generations, and across various actors within the space. So those insights were then channeled to the development of an engagement strategy. Next slide. Next. An engagement strategy that was anchored on, one, simplifying a message that has for long been fragmented, focused only on women in a country that is still very patriarchal, and by effect making it more of a special interest group conversation. So that's the challenge that comes with a fragmented conversation. Second, it was also anchored on the need to build positivity around cervical health and reach women at multiple stages of their cervical health journey. Then third, there was a need to create a platform that would unify various actors in the space so that all speak in one voice, therefore supporting aspects of system advocacy, and finally, driving demand and getting more women connected to services. Next slide. So this will birth the campaign brand, now known as Kizazi Chetu. As Heather had explained, Kizazi Chetu is Swahili for our generation. Kizazi Chetu would serve as a rallying call for this generation of Kenyans and other stakeholders to set the foundation for the elimination of cervical cancer in Kenya. So next slide, please. So I think this has been explained in part by Heather. So one is a rallying call for this generation to take action around or to set the foundation for eradication of cervical cancer. Two, bringing together all Kenyans to engage in cervical health conversation without the biases and stigma that have placed the barriers for women in accessing services. And three, the movement was also designed to push for a Kenya where women are cervical cancer free, and as a result, they're bold, autonomous, and able to chart a way forward for their lives. Next slide. So we set out to have Kizazi Chetu as a multi-sectoral and intergenerational approach towards eliminating cervical cancer in Kenya. And this was done by bringing together diverse stakeholders and actors. Some of the over 20 organizations, next slide. Some of the over 20 organizations and partners whose huge support led to the development of the movement, as well as subsequent public engagement initiatives include the Ministry of Health in Kenya, the National Cancer Institute of Kenya, Emaristops Kenya, We Women for Cancer, Akili Dada, the Grace Cup, and but that's just to name a few of them. Next slide, please. So through the feedback from the supporting organizations, we crystallized our strategy as simplifying cervical health messaging for engagement with multiple audiences, starting this new conversation on cervical health through a coalition of stakeholders, including service providers, survivors, as well as opinion shapers. And third, key to this campaign was driving demand for cervical health services. Next slide, please. So this strategy will be implemented through, of course, a unifying platform that is authentically Kenyan and that will normalize the conversation. So that's the Kizazi Chetu brand itself. A PR and influence campaign that will engage Kenyans and decision makers. Content development through content development to support the work of the partners and other actors in the cervical health space. Then collaboration around service access by signposting to partner facilities all through the campaign. And finally, a microsite that played the role of an access point to information and where Kenyans could find services that were close to them. Next slide, please. So the campaign was run as a moderately intense sprint over a period of 8 weeks between May and July this year. Next slide. So there were 3 activity streams. There were bi-weekly tweets which would draw in the bulk of the conversations of the campaign. So we engaged experts from various backgrounds and engaging them on various cervical health themes to build awareness and educate Kenyans. We also had op-eds in print publications, media panels, and one-on-one interviews developed in collaboration with partners, thought leaders, key influencers as well, to build a case for action by policymakers and Kenyans around cervical health. The third stream, social media activations, was anchored on the Kizazi Chetu social media platform, serving as a content hub and supported by influencer engagement, with the overall objective of making the conversation more inclusive and normalized, as well as signposting to service access points for Kenyans. Next slide. So here are some of the influencers who engaged in the campaign. The Kenyans on the call might know some of them: across media personalities, activists, content creators, whose platforms afforded the campaign that enormous reach that we got. Next slide. So the influencers were complementary to the experts, survivors, and thought leaders, as well as actors in the cervical health space, whose experience served to strengthen the campaign and give that expert touch to the whole movement. So next slide. So how did the campaign fare on? Next slide. So we designed a measurement and evidence plan to gauge conversations, service uptake from partner facilities, and how many Kenyans are reached by the campaign messaging. Overall, the campaign reached 10.5 million Kenyans on social media with 64 million impressions, which is the number of times that Kenyans interacted with the campaign messaging. From the service perspective, there was a 102% increase in screenings at partner facilities in comparison to the same period in the previous year. So let's have a look at the news media results. Next slide, please. Next. So on the media front, the campaign reached 29 million Kenyans and generated a PR value worth 485,000 USD across print, broadcast, and online. So we'll just have a quick look at what was covered over the next 3 slides. Yeah, just run through them. The next 2. Next, yeah. Yeah, so that's what came out across print, broadcast, and online. Sorry, just go back to the next slide. I mean, to the previous slide. Back. Back, please. Yeah, there. Okay, next, with the yellow background. Yeah, so social media conversations were tracked via 2 hashtags. Cervical Health KE, which was us making an attempt at changing the narrative around cervical cancer to cervical health. Then there was Kizazi Chetu, which is of course the campaign. So with at least 64 million impressions, the campaign served to get Kenyans talking and having a more positive view around conversations in cervical health. Next slide. So the mix between bi-weekly tweet chats, which with renowned thought leaders as well as influencer content, provided a mix of normalizing conversation as well as expert input. So this is some of the content that came through. Next slide. And the same as this. So I think we can move to the next slide as well. So from a service point of view, next slide. Through our key service partner, which in this case was Maristopes, the campaign drove a 52% increase in screenings during the period, and that's in comparison to the 3 months prior to the campaign. And at the same time, there was a 102% increase in comparison to the same period of the campaign in 2020. Next slide. So we also monitored intent for action through Google search data in Kenya. Next slide. So interest in cervical cancer screening increased by 160%. So this is basically an increase in the number of Kenyans who searched the terms, the phrase cervical cancer screening on Google. Next slide. We also noted a considerable increase in searches for HPV, which was almost non-existent prior to the campaign. So that was some good progress in terms of Kenyans being interested in learning more about cervical health. And finally, next slide. During the campaign period, while we may not entirely attribute this to the 2-month campaign, there was a 113% increase in nationwide cervical cancer screenings. So let's move on to the learnings, which is the last component campaign. The next slide. So from the campaign, one of the key things that stood out quite strongly was the need to include more non-traditional voices in the conversation, which I think can be extended further in subsequent campaigns. When we look beyond, your doctors, your healthcare practitioners, who else has an influence over Kenyans that we can include in the conversation? Then the diversity in voices also serve to make the conversation a more human conversation, as opposed to where it was being viewed as a special interest group only conversation. Next slide. Then there was the critical role of men and male allies in the conversation. One thing we noted prior to the campaign was that cervical cancer conversations were largely limited to spaces where women were. But being in a patriarchal society, it becomes key to have men as part of this conversation so that we're able to lower the stigma and the biases around cervical health, which have long contributed to the inability of women to access services or even speak about cervical health. Next slide. Third, we were able to see the benefits of collaboration across the cervical health space. And this includes individuals contributing to the conversation, as well as we have seen the results of collaboration across comms and the service aspect of it, so that we are able to achieve more and over time find ways of building or creating a journey that is consistent all through and creates a better experience for women. So that a multi-stakeholder approach has been really key, especially in this campaign, and something that can be taken forward. Next slide. Then finally, there is a need for continuous and consistent messaging. As we were taking our analysis, we found that because Cervical Cancer Awareness Month is in January, after that month, there is a very steep dip in the number of women getting screened, the interest in cervical health subjects such as HPV and screening from the searches that exist in that are run through Google. So that aspect of our messaging being carried throughout the year, regardless of the special month that we have for cervical cancer, is key to building daily conversations and contributing to the long-term elimination of cervical cancer. Yeah, so what next? Next slide. So in collaboration with Together for Health, we are exploring the expansion of this campaign beyond the urban areas that we had initially focused on, and looking to move into new geographies, as well as include more messaging beyond screening and treatment to even look at HPV vaccination, so that we have a more holistic messaging with a broader reach, even beyond the urban areas. Second, we are looking at integrating cervical health messaging with service delivery, something we trialed out this time, but we're not able to fully implement it. And the idea is to create an experience for women that is carried through how they hear about cervical health messaging and what they get at the facilities where they either go for screening or for treatment, because our holistic experience is key to lowering the barriers around that keep women from accessing cervical health services. Then finally, we are looking forward to co-designing a future-focused roadmap, which will serve to guide the development of policies around new interventions, and also how those interventions can be scaled to allow for a prevention of cervical cancer in Kenya. And that's the presentation for today. Happy to share, and thank you for your time.
Thank you, Andy. That was fantastic. I appreciate that and looking forward to questions if folks have questions about the details surrounding the campaign. Next, I would like to introduce you to our next speaker, Ms. Benda Kitaka from Kilele Health, who will provide details on the critical role of patient advocates in cancer and the role of Kilele Health in our next phase of the campaign. Benda is a health advocacy and behavior change communications specialist with over 20 years experience in communications, research, and health advocacy. She is the founder of Kilele Health Association, a Kenyan nonprofit organization which is based in Nairobi with a mandate to operate across the country's 47 counties. Benda sits on various global, regional, and local technical working groups in an advocacy and an advisory role. Her presentation today is entitled A Cervical Cancer-Free Kenya Starts with Our Generation. And with that, I'll hand it over to you, Benda. Thank you.
Thank you so much, Hifa. And thank you everyone for joining us today. Andy, thank you for that very insightful presentation of what Kizazi Chetu is all about. I think when we speak about cervical cancer and we speak about generations, I picked this specific subject because it is what Kizazi Chetu stands for. That within this generation, it is where we're going to guarantee that our women, our girls, are safeguarded against cervical cancer. And so when we think about Kizazi Chetu, we're thinking safeguarding cervical health. But the other thing is Kizazi could also be taken to mean the cervix itself, and therefore our cervix, Kizazi Chetu. Let's move to the next slide. I'm going to talk briefly about who we are as Kilele and why we are on this platform today and why we are on this platform with Kizazi Chetu. As an organization, we focus on our members working together towards advancement of quality of life in people living with cancer. And with this, we're looking at a life beyond what has been touted as you can't do this, you cannot do the other, but in terms of quality of life and survivorship for cancer patients and survivors. But as we do so, we also look at it from the point of people living with chronic illnesses have been there, but the shoe worn it, it's gotten worn out, and therefore they have the lived experience that can inform the community on how to prevent walking that journey. They say the journey of 1,000 miles starts with one step. And often if we have a roadmap to where we're going, the journey will be easier. And so as Kilele, we focus on the 4 pillars that inform quality of life, which is the physical fitness, the mental wellness, the community wellness and social well-being, as well as financial wellness of patients and survivors. Moving on to the next, please. And so when we talk about Kilele, we have our program, which is Kilele Challenge, where we are challenging perception, inspiring purpose, and motivating behavior change. And I will explain further. Next, please. In challenging perceptions, I've talked about what the community is doing as a community of survivors and caregivers. We have an annual Mount Kenya climb, which is cancer survivors climbing the mountain themselves. And why we're doing this is for 3 things: to reduce stigma and fear, because people who have been told you cannot do, and they actually prove that they can do, when the community looks at them, they say, oh, I can do that too. So we're reducing the stigma and the fear that is viewed on cancer. Secondly, we're changing narratives, where it's no longer an issue of, I don't want to go get screened, or I don't want to be aware of my cancer status because I don't know what will happen to me. Instead, we're saying that yes, we can see they are climbing mountains. We can see they are overcoming physical, mental, and social well-being barriers towards their optimal health. What can we not do as people who are in the community? And thirdly, we are inspiring and challenging the perception that cancer is a death sentence, and instead showcasing that indeed, even with a cancer diagnosis, you can be able to live a quality life. Next, please. The second thing that we're doing with the Kilele Challenge is inspiring purpose, whereby we equip cancer survivors and caregivers as agents of change in the community for advocacy, for capacity building, and for skills transfer to the community so that the community owns its own health. On this, we have two components, which is the storytelling for impact, and the other one is mental wellness through a program that we call Mindful Remission. Moving on to the next place. Thirdly, we are motivating change, where we go to the community and the survivors share their lived experiences, demonstrating real-life examples to showcase how survivorship is real and how early detection could be. In those photos, you're seeing two photos. One is survivors in a community outreach, where we've partnered with a childhood cancer organization to create awareness on childhood cancers, but also to create hope that parents can be agents of change for their children. Secondly, we have another one where the survivors themselves have knitted their prosthetic breasts, and they are giving this to the community so that they empower women for dignity. And that way cancer is viewed differently. From when it is viewed with stigma, it starts being viewed from a place of power. Next, please. We also have our media advocacy component, where we have survivors telling their stories across different platforms, be it social media or on mainstream media, so that we bring the story of hope, the story of prevention, and the story of people taking charge of their own health. And next, please. And as I've mentioned, we also have an annual symposium that we do, and which we featured with even the Together for Health Executive Director, Heather, last month, but one, where we talk to policymakers to be able to inform policy in various issues that relate to cancer and cancer care and prevention. Why am I telling you this? The next slide, please. This is because stories are found, they bind us together. Stories are memory aids, instruction manuals, or moral compasses. When I was growing up in a little village somewhere, my mother would put us around a table, around a jiko, when we were roasting maize and having conversations. She would give us stories about goblins and marmots and hyenas and lions and elephants, and how a little rabbit could outwit that big animal called the elephant. And she would create mental images in our minds about how, with brilliance, with knowledge, with executing that knowledge and cunning, the hare could outwit the elephant that is big and huge and mighty and all. Why am I telling you this? Because when I say stories bring us together, the four partners that are on the table right now speaking are looking for more partners as well, for us to be able to be together to outwit this giant that is called cervical cancer. Go to the next slide. When you think about it, just last year, we are about 17 days away from the launch of the global strategy for cervical cancer elimination. This was launched last year with a lot of pomp and fanfare. And with that, there were three strategies that the WHO gave us. The targets were 90-70-90, that would help us safeguard the health of our women and girls in 3 generations. That is, girls who are being vaccinated by the age of 15, we should reach 90%. Women who are between the ages of 35 and 45 years should receive at least 2 screenings with high precision performance tests. And thirdly, any woman, at least 90% of women found to be having any cervical disease should be treated. In a nutshell, we were told that if we can achieve this by 2030, we will be on the roadmap towards eliminating cervical cancer. Do you remember the hare that I mentioned earlier that my mother would tell me about? And the elephant that the hare or the rabbit would be able to outwit? The hare and the elephant right now is this big elephant of 90-70-90 for us in the cervical cancer conversation. But before I can define that and talk about why I think that's the big elephant in the room, let's define what those three generations are. What forms a generation is our common experiences, what we have attitudes towards, what circumstances define us in terms of demographics, could be our socioeconomic status, could be our cultural influences. And of course, our birth, the year that we're born, and the kind of experiences around that year and around that cohort also does inform our perceptions and therefore does inform the generation. So I often struggle with whether I belong to the baby boomers, the millennials, the generation X, or the Gen Z, because there are days I wake up feeling 16 and there are days I wake up feeling 64. I'm still thinking about that. But what about you? Let's talk about the three generations I mentioned earlier that we are safeguarding our cervical health in. Move to the next slide, please. Next slide. If we think about the three generations, we have the first generation is the girl that we're supposed to be doing 90% of vaccination. 90% of vaccination means that this young lady is up to the age of 15. Then we have the woman who should be receiving the 90% of women receiving screening at the ages of 35 to 45. And that same cohort, that same generation is also targeted for the treating, because we are to reach the 90% of any woman found to have any cervical disease should be treated. There are two generations that have been missed in that conversation. The first generation, and this is the big elephant in the room, is the young lady between the ages of 16 through to the age of 35. What narrative, what story is she hearing about cervical cancer? What decisions will inform her personal perception, her common experience, her attitude towards screening or prevention of cervical cancer? The other woman that has been left as a cohort is the woman who is the survivor for cervical cancer. This is a woman who, at one point or another, she was either fitting within the three cohorts that I've spoken about, either for vaccination, for information and awareness to equip them for prevention, or for the screen and treat. But the disease came and she got an experience. How are we reintegrating her into the conversation to help with the prevention? She's walked the journey, she knows where it hurts. How can we utilize that voice to ensure that we're preventing for the future? Next slide, please. Kizazi Chetu has done a beautiful thing, because for the longest time, I've worked in this space for 10 years now in advocacy. And in that advocacy space, something was always missing. Initially, it was we didn't have vaccination in Kenya. We advocated, and the Ministry of Health was very gracious to bring that service to our girls in 2019. Secondly, advocating for policies and guidelines and screening guidelines that can be utilized for this woman that is in the second cohort for screening and treating. And we've seen a lot of uptake of technologies. We've also seen the government of Kenya launching quite a number of policies. And the largest strategy that informs all these policies, all these guidelines on how we can implement a cervical cancer prevention strategy. The one thing that has been, and the one thing that has been missing, is what Kizazi Chetu came and did, which was integrate all these voices together, but at the same time, take that young lady who was being missed, go back one slide, please, who was being missed in this conversation, and engaging her with information, equipping her with data and knowledge, and educating her to be able to take charge of her health. If you think about it, these young ladies who have engaged, I think I had a number mentioned, over 10 million, reached on social media. These young people, these young ladies, these men who have been engaged by Kizazi Chetu have become agents of change for the community. Extending that further, because majority of them still have their cervical health and have not yet discovered any lesions that need to be treated, our goal should be to equip them with information that can help them maintain that cervical health. And that is what Kizazi Chetu is doing. So go to the next slide, please. As Kilele, when we started conversations with Heather and the team, it was from the point of that expansion beyond the urban areas, beyond the woman who has a smartphone, beyond the one who can access Facebook, Instagram, Twitter, LinkedIn, beyond the one who can come to the urban centers. That woman who is in the village who needs to also be informed and equipped with information to help her take a decision. The second reason was to expand reach in integrating the HPV vaccination messaging, so that the young lady who is below the age of 15 can be and will be well equipped with information to even be an agent of change for her parents to say, can I get this vaccination for myself? And thirdly, to also cascade that information, engagement, and community mobilization at the community level. As Kilele, we're looking at this as a golden opportunity to engage survivors as community ambassadors for elimination. Remember I said they've won the shoe, they bought the shoe, the disease came knocking. They won the shoe, they went through the treatment journey. They know where the shoe is pinching, be it at policy level, where they would be able to expose the gaps that they've seen, and therefore they can ask and demand for concrete answers from our policymakers. Secondly, they can engage with the mainstream media with human interest stories that can then be able to be relatable. When I tell a woman, and I'm speaking this English, we call it in Kenya English of nose. When I'm speaking that kind of English, it's very different from a woman in the village who is speaking in the local language, saying, I went through this, and I know that you can survive cervical cancer if screened early. I went through this, and I want you to take your daughter to be vaccinated, because then you will have prevented for her for the future. And of course, looking at social media engagement through storytelling, many of the survivors are also on those social media platforms. And when conversations go online about preventing, they're able to share their personal story as a lived experience towards prevention. Secondly, in community engagement, they say, if you show me, I will believe you more than if you tell me you heard. And it's true. When we have our survivors say, I was diagnosed at stage 3B, you can prevent and be screened at even stage 0 when the cancer has not developed. It becomes so much easier for that woman to believe and to want to go for screening, therefore demand creation. Secondly, because they know where these facilities are, they know where to go for the community health volunteers, they know where to get the services, that linkage to service becomes an easier referral if it's someone who has a lived experience of what they've experienced. Lastly, access to care, navigation and reintegration, because they've been there, done that, and bought the t-shirt. It's easier for them to pass on the baton and say, I have been there, I know, I will walk this journey with you. What we're doing in Kilele, by climbing mountains, by hiking, by going to the community to show the lived experiences, by inspiring this hope, is what we are bringing to the table for the phase 2 for Kizazi Chetu. That together we will move faster, further, deeper into the community, lowering the barriers for access, lowering the barriers for uptake of the messaging, introducing new voices beyond what has been seen before, and also expanding beyond those urban areas that have been covered before. Next, please. So my ask, as I come to an end of my presentation, is that if you're listening to us today, we know, as the Kizazi Chetu partners, that to go far, we can only go together with others. And it is not enough for us to say we have a brilliant campaign, we have a brilliant platform, if we're not able to get everyone else on board and to say, where do we play to each of our strengths? I've mentioned how as Kilele, we are seeing our strengths, being in the survivors as community ambassadors for elimination. What about you on this call today who has an organization or an institution or a fund, or even a network that can get us to the policymakers? What is your strength on this table? My challenge to all of us is it will take 3 generations for us to kickstart this journey. It will take to 2030 for us to be able to get on the road towards elimination. What are the steps we can take today so that we move this needle forward for protecting cervical health for our girls? That is the end of my presentation. Thank you so much.
Thank you, Benda. That was just fantastic. I really appreciate and always admire your perspective and the work that you all do at Kilele Health. So thank you. Before, Sarah, could you move on to the next slide, please? Thank you. Before we open the floor for questions, and please do put any questions or comments in the Q&A box so that we can take those and speak to our presenters. Before we do that, I wanted to also acknowledge a new partnership that we are engaging in Western Kenya with some colleagues and partners who work in the Lake region of Kenya. We are working with excuse me, one moment. Along with plans to expand our Kizazi Chetu campaign into rural settings and partner with new service delivery partners, we're also excited to announce an upcoming campaign that will feature Kizazi Chetu and share the importance of early detection and treatment for cervical cancer. Our partners, Matibabu Foundation, TIBA Foundation, and others are now making preparations to launch an awareness and call to action campaign for cervical health that will take place between November 17th, 2021, and which will run through January of 2022. In that partnership, key campaign partners include the TIBA Foundation, the Matibabu Foundation, Africa Cancer Foundation, the governor of Kisumu County, and the Council of Governors, as well as the county's First Ladies Associations of Kenya. And this campaign is being put together to celebrate the resilience of Kenyan healthcare workers by providing professional uniforms or scrubs to 25,000 health workers across the Lake Economic Region. These scrubs have been donated by FIGS, which is a US-based company that provides professional uniforms. Each of the 25,000 health workers who receive the scrubs will also receive a call to action around cervical cancer prevention and key messages around the importance of prevention. And so we have offered up the use of our Kizazi Chetu messages, our microsite, and other simply to move these messages across into new regions that we've not worked in before. So we're excited for this campaign to kick off, which actually will launch November 17th, the 1-year anniversary of the call for elimination. And so we thank and acknowledge our partners at Matibabu, TIBA, and other local partners. So with that, let me turn it over to our presenters and discuss questions for you all. We did have a question that came through, excuse me, during the presentations from Lucy Chiari, who asks, did you notice any influence on HPV vaccine, for example, caregivers interested in getting their daughters vaccinated against cervical cancer? Lucy, thank you for that question. If I may, I would actually like to kick off the response for that question, and Andy, please add anything if you think I've overlooked anything. But we made a decision early on based on really the scope of the resources that we had and the sort of priorities of the service delivery providers that we were working alongside to really emphasize, to provide comprehensive messages around prevention, which of course looks across the cascade of care at HPV vaccination, screening, early treatment, and treatment for cervical cancer. But we wanted to focus in on the messaging around screening and early detection. So in this next iteration of our campaign, we do want to open up for more key messaging around, the need and the importance of HPV vaccination for girls. But we knew that would take us in a slightly different direction than this campaign had we focused on HPV vaccination. So while we did have comprehensive messaging, we very much focused on screening and treatment as part of key messaging for this campaign. Andy, do you want to add anything there?
Yeah, sure. So as mentioned, our messaging was focused on screening and treatment. As we were trying to mainstream what was already a misunderstood conversation, so we saw it best to start off with a simpler line of messaging. Now, going further, there is the aspect that resistance for HPV vaccination is closely linked with the question around sexuality of girls under the age of 18. So that's one aspect of the prevention journey that we still need more time to work on around tackling that. So that's part of the reason why we didn't look at it in the first part of the campaign. So as a result, we did not measure the influence of the campaign around HPV vaccination. But hopefully we can do that in the next phase when we also have the service infrastructure in place to allow for that. Yeah, thanks.
Great. Thanks, Andy. Thanks for those. I just want to ask, I'll ask both of you the question, and maybe I'll start with you, Andy, and then I'd love Benda's thoughts as well. I know you both have been involved in communications campaigns, of course, in health and in other areas for Kenya for some time. And I just would love, a brief reflection on what do you think this, or why do you think this campaign has resonated with both men and women in Kenya? And is there anything that feels different about this campaign as compared to other campaigns that you've worked on? Andy, please.
Sure. Well, the reason why this campaign has been able to resonate with men and women is that it did not shy away from posing that challenge that men are also involved in human contracting cervical cancer, so they have a role to play. And then there's also the role that men play in keeping women from accessing these services due to the myths and misconceptions that exist around, say, a woman who develops cervical cancer is probably promiscuous. So having men understand cervical health, I think it's a new learning that many have had, and that's kind of enabled it to resonate with a good number of Kenyans. There's also the fact that through the campaign, we came in understanding that there are already entities in this space who are doing quite a lot of work. So let's collaborate with them to make their work much bigger, as opposed to us trying to figure out everything by ourselves, which could have probably drove us to the wrong direction. But organizations already in this space understand what needs to be done, and bringing them together through some of the activities we're doing. It was also really key to amplifying a messaging on cervical health and making it resonate with Kenyans. I think those are the two that were pretty critical. Bringing in new voices or non-traditional voices, and being open to collaborate with as many stakeholders who are already active in that space.
Great, thanks, Sandy. That I think you're absolutely right. Benda, any other thoughts or reflections?
Yes, absolutely. So one of the things that Andy has mentioned was the organizations that were brought on. I think with the organizations, there was also consistency of messaging so that all organizations are speaking with one voice. And I think that brought a lot of repeated, consistent messaging for people to be able to see that it's not just one entity, but all organizations involved that were talking about it on social media. But secondly, I think the critical factor that even drew me as someone who has been in the space for this long and the freshness was the diverse voices. It was no longer the same people speaking about cervical cancer. It was a different set of people speaking about cervical health. So that shift from the voice of cervical cancer to the voice of health, from the shift from same old faces, not old necessarily by age, but also old by seen on the same platforms every so often talking about it, it brought a freshness to the messaging. And also bringing men to the table, bringing younger people in terms of age to the table, engaging in a language that they understand, brought that relatability. It was no longer it's them that are being spoken to, them being older women who need to be screened. It was all of us are included. We are touched by this, if not as patients, but also as women who could be potentially at risk. I think that relatability is what really, really drew us to the campaign. And that's what we are hoping we can continue even in phase 2, relatability, consistency, and more diverse voices. Thank you.
Thank you, Benda. I think we have time for one, maybe two more questions. Let's see. We have a question coming in that says, I have a question regarding integration with SRH services, sexual reproductive health services. Was this done in an intentional way? And if so, how effective was this in reaching more women and changing behaviors? Andy, I don't know. Would you like to speak to the question around integration, or would you like me to take a crack at it?
Well, I can take a crack at it. We didn't really integrate fully with sexual and reproductive health services. Now, that's one of the insights we got as part of the groundwork on the campaign, that cervical health is not spoken about, but there are already so many initiatives around sexual and reproductive health through which it can be plugged into. So that's something that we hope we can explore in the second phase of the campaign. Now, also, as we think of that, there is a sexual and reproductive health campaign that we have worked on around contraception. There is also a similar concern, or not exactly a similar concern, but a related concern that when young people seek out sexual and reproductive health services, specifically contraception, they find that these services tend to be in places where there are maternal health services and cervical health services. So I think it's something that needs to be approached, because to drive cervical health, we need to bring it into what is more common. But for young people who already struggle with accessing sexual and reproductive health services, they feel that contraception needs to be removed from other sexual and reproductive health services. So it's something that that we feel we need to explore and see whether there's a possibility of striking a balance or innovating around it to ensure that all young Kenyans and all women are taken care of in terms of their sexual and reproductive well-being.
Great, thank you. I'll give you that last word, Andy. Thanks for everyone. We've just run about a minute over. Well, I want to say thanks to everyone, our presenters, and thank you for joining us on what I know has been a busy morning with many different options and places to go in our world. So We thank you again for joining us today, and we will post this recording of this broadcast in the coming days. Thanks, everyone. Have a great afternoon.
Thank you for having us.
Thank you. Have a good one.